Good afternoon, ladies and gentlemen. I'm Elmart Ojijo. I work in KEMRI in clinical research. Today, I want to focus our attention into HIV program. And the topic of my discussion is on the risk of overweight and obesity and some of the associated factors for the patients who are taking this medicine, DOLUTEGRAVIR, together with the combination of other antiretroviral medicines. And this study was done in Western Kenya at a facility within the KEMRI organization. Kindly, next. You can skip the overview. So HIV is still a pandemic, and we realize that 39 million people are still living with the virus, and about 40 million have since died. And the good thing is that we have 29, almost 30 million accessing ART as of 2022. There have been new advances, and these new advances have introduced antiretroviral medicines that have reduced the pill burden, reduced the drug toxicity, and have high potency in achieving lifelong suppression of HIV virus. And the new advances have shown the introduction of this class of medicines, the integrase strand transfer inhibitors. And these class of medications were introduced into the system in 2014. And the new drug in that class, the DOLUTEGRAVIR that we want to talk about, was introduced in Kenya in 2017. And as you all know, this is a very good medication and still remains the cornerstone of ART regimens. It is both used as first line and second line. And we want to see some of the challenges that we may be encountering with this medication. Reports of DTG-based regimen associated with weight gain have emerged since its inception. And so monitoring of safety is very paramount. Next. So what is the problem? Long-term safety data on this medicine is still unknown. Next. Next, please. So we want to address some of the reports that have been emerging on the weight gain associated with the use of this medicine. And as you all know that weight gain can result into obesity, and obesity is a risk factor for other HIV comorbidities, including high blood pressure, diabetes, and so on. Next. So our research question is whether the use of the combination with this medicine can result into weight gain. And if it does, what is the prevalence? And number two, we also wanted to know some of the socio-demographic factors associated with weight gain in this cohort of patients. Next. So those were our major objectives. We wanted to know the prevalence and also the socio-demographic factors associated. When we talk about DTG-based regimen, that's the combination we are talking about. We have tenofovir, lamivudine, and DOLUTEGRAVIR. Next. So in our methods, this was observational, cross-sectional. And out of 332 medical files that we sampled, 83 met the inclusion criteria. And those were our inclusion criteria. One, HIV positive patients, adults, 15 years and above, and good adherent to DTG-based regimen. Next. Quantitative data analysis was done, and repeated measures ANOVA were used to make inferences on whether there was significant increase in the weight of patients at baseline and 6-monthly interval for the next 18 months. Next. So in summary for our methods, 83 files were analyzed, and weights and heights were taken at at baseline 6 months for 18 months. Then I want to emphasize on the body mass index. This was the body mass index is a simple index that helped us to classify our clients whether they were underweight, normal, overweight, or obese. Next. So on the results, on relationship between weight gain or loss with previous regimen, there was no statistically significant relationship. And secondly, on weight gain as a result of using this regimen, there was a significant change in weight across the 4 different time intervals. Next. On the prevalence of overweight and obesity, as you can see from the bar chart, the overweight increased from 29 to 33. Obese patients increased from 14 to 18%. That was an overall of 4% increment. Next. Then about the socio-demographic risk factors associated with overweight, only 2 factors we found were significant, and that is age and marital status. Next. So in our discussion, we found that there was a systemic increment in the number of overweight and obese patients following the initiation of this regimen. However, due to limiting nature of our study design, weight gain was not entirely as a result of using this regimen. And some of the significant predictors to risk factors for overweight, we found out that obesity, on marital status and age were the major predictors. Next. So these were some of our study strengths. The findings are very valuable for improvement of HIV management in our facilities, and provide a foundation for more research to be done across HIV implementing sites in Kenya. Next. So in conclusion, progressive weight gain associated with the use of DTG-based regimen, coupled with other confounding factors, may be risk factors for HIV comorbidities. And therefore, our study recommended that we follow up routinely on patients' BMI. Then we do regular screening of other HIV comorbidities associated with weight gain. Then there should be routine lifestyle diet and nutritional counseling. Otherwise, I thank you for listening. May you have a blessed afternoon.